Okay, so I'm demonstrating how to place a muzzle onto a pet. First of all, you want to find out the appropriate size. We've got here small, medium, and large muzzles. So you want to measure to make sure you've got the right size. And then you will come around from behind, place the muzzle, make sure that it's nice and loose when you snap it in, and then you'll tighten it down to make sure that it's secure. Okay, so I'm demonstrating how to use a restraint pole. We have a lovely stuffed animal here. So when you use these, you're going to place it over the neck, tighten it, and then twist it to the right, which locks it. And then you can safely use your pole as distance between you and a dog that is aggressive. And that's it. Okay, so this is Zach. He's our clinic cat, and we clean his ears quite often, and he's not always the most compliant patient, so we wrap him up in a towel, which seems to work well for him, so that's what I'm going to demonstrate today. So I get a nice large size towel, open it up, and just kind of burrito wrap him into this. That way he can't use his back legs to kick and things like that. So then we just kind of get him nice and tight and hold him kind of close to your body. That way we can clean his ears and things like that. So that is that.
You're facing it.
Is it going? Okay, so we are demonstrating how to properly catheterize a bladder. Our patient has been anesthetized, he's been in surgery, so we're going to go ahead and do it before he wakes up. So I am holding this so it doesn't slide back in. Dr. Anderson has lubed up the sterile catheter. It's a 5. And so now she's inserting it, and it's going to go all the way into the bladder so we can get the urine out of it. There we go. Perfect. And that's all. Okay, so this is Pop-Tart, and we're going to be demonstrating how to get a free catch urine sample. She's had some urination issues in the past, so we're going to catch some so we can run a UA on her. Is our sample. Okay, so we're doing a cystocentesis on Tatsu right here. He's a block tomcat, so we are going in trying to relieve some of the pressure on his bladder. That way we can get him stable so we can end up anesthetizing him for a catheter.
That's a lot of blood. Poor baby, I know. I'm just gonna let it fill up, okay? You're doing great. You're doing great. Okay, I'm gonna pull it out for just a second. That's what his urine looks like. Ugh. What we may do, let's move back to L-shadow. It'll be easier to judge how much we're getting versus how much we're relieving. So we'll run that.
Okay, so we're going to express Millie's anal glands. I've got my gloves on and some lube. And so you will lift the tail up and insert the finger. And I use kind of a paper towel so it doesn't squirt out at me. And then you find the gland and you milk it, kind of like start just kind of pushing and squeezing that material out. most dogs can do this on their own, but some of them need help. So one is emptied on that side. Insert my thumb on the other side, that way I can express it the way it needs to be. And you'll feel the material coming out. Just make sure you get it good and emptied. And this should be the type of material that comes out of it. If it's weird color, weird texture, then that may indicate something going on back there. But hers is all normal, expressed very easily. And that is all. Okay, so I'm going to demonstrate how to trim toenails on a dog. This is Hannah, and so I'm going to start by using her front leg. You want to make sure you don't go back too far to quick them, but you want to get as much off as possible. And you can kind of start off small and then keep going until it's enough. You don't want to go back to where you can make them bleed. Alright, so I'm going to be demonstrating how to trim Bob's toenails on a cat. A lot of times you can see the quick on the cat, so it's a little bit easier to do. But if they're long, you want to kind of go up to the top where it curves and just take that tip off. And then you'll do it with all of them. That is it. Okay, so I'm going to demonstrate how to pill a dog. This dog gets medications in the morning and at night, so we use this pill poker for that. So you'll take his head, open it from the top, and then shove this part down there and push the plunger. You want to make sure that you get the right spot. You don't want to go anywhere to where it gets stuck, and then we'll chase it with some water. That way it does okay. Hold on. There we go. Chase it with water. Hold on, buddy. There. That's better. Alright, so I'm going to be pilling this cat. This is a Capstar. So hand pilling, we're going to kind of grab the top of the head, open the mouth, and then drop the pill back down in there. And we'll chase it with water. That way it doesn't get stuck or anything like that. So I just take it like this, open it up, drop it down, and push it down. And that's it. Alright, so this is Rufus, and he is a Basset Hound, so he's got these great big ears and chronic ear problems. So today we are going to be flushing his ears out with regular foamy cleanser, and then we'll dry it out and then apply his ear medication, which is True's Ultra with Baytril in it. So we will begin. I've got the ear cleanser in here, and I'm just going to put it on the cotton ball and then put it in his ear, kind of massage around in there, making sure that all of that liquid goes down to the very bottom. Clean it all out. And then if there's any, big chunks in there and stuff, we'll get them out with this. Sometimes there's some kind of in the cracks and crevices, so we'll use a Q-tip to get those out. You want to make sure that it's dried out really good before you put the medication in there. And then take a couple more cotton balls to dry this out. And they're not terribly dirty today, which is good. Once they're nice and dry, then I'll take his ear medication and just give a nice squirt in there, enough to where it'll mush around a little bit and get to where it needs to go. He had a lot of yeast and rods in his ear, so the medication we chose is the one that'll properly heal that for him. If there's any excess, you can kind of dry it out a little bit. And then we'll do the same thing on the other side, and then that will be all we do for him. Alright, so we are going to be cleaning Zach's ears here. We've got some Flush, it's the Triz EDTA. He's our own clinic cat and he gets some ear issues occasionally. So we're going to clean him today and then administer a little bit of malodic in there to make sure it doesn't get inflamed or anything. So I start by soaking the cotton ball with the Flush. He doesn't really like this all that well, so I don't squirt it down into his ear. And then I put the cotton ball in there and kind of massage it around a little bit. That way it gets deep down in there. Wipe it out. And then I take a dry cotton ball and do the same thing and kind of massage it around in there, trying to dry out that canal. And if there's real heavy debris and things in there, you can use Q-tips. Again, they don't really like all of that because it's irritating. But you just want to make sure that it's nice and dry down there. So that's the one ear, and then I'll use the malodic and kind of hold the ear up so you can open up that canal, and then you'll stick the nozzle down in there and just give it a nice little squeeze. That way it goes down into the bottom, kind of massage it in there. If there's a bunch of excess, you can kind of wipe it off. And then you'll repeat it, doing the other side the same exact way. Okay, so this is Gracie, and we're applying her monthly Advantage Multi. We weighed her to make sure that we've got the proper size for her. When you do the topical flea preventions for cats and dogs, you want to make sure that you get it kind of top of the shoulders, back behind the neck, so that they can't actually get to it to lick it off. And then part the hair, make sure you get down deep into where the skin is. And then you apply a little bit here, and I do a couple of spots, that way I know that it gets in there. Okay, so I'm demonstrating how to place an esophageal stethoscope. We've got our patient already under anesthesia, so you'll take this and you'll measure it to about the 5th rib so you know how far to place it. And then you can mark it with a piece of tape so you don't go any further than that. I'm going to put a little bit of lube on it so it slides down nice and easy. So then I will open the mouth, pull out the tongue, slide it right along the side, and it should go in nice and easy because we've already got our ET tube in. And you just keep going until you get to the spot you need to go. And that is it. Okay, so we're with Sebastian today, and we are going to be checking a couple of things on his eyes. First thing we're going to do is check his tear production. You want to make sure that that's the first thing that you test, because if you put drops and things in there, your test can be altered. So for this, the strips we put in the eyelid, hold it there for about a minute until the blue kind of bleeds back, and it'll give you a number of what your tear production is. Normal is about over 15, so we will go ahead and put this one in his left eye and see what it's reading. So then you will want to pull the lower lid down, insert the strip, and keep the eye closed while it's running, doing its little test. And you can see the blue kind of wicking back up to the top of this thing. All right, and we're not at a minute yet, but it's already at the 15. So for him, his tear production in his left eye is really good. Okay, so we've completed the right eye, or the left eye now. We had inserted the one on the right eye. Again, it's already up to the 15 and it hasn't been a full minute yet. So that means that the tear production is actually really good. So then once you're through, you'll just pull the strip out like so. This is what we had for our left eye and our right eye. Okay, so next we are going to stain the eyeball. This is fluorescent stain. You take the strip out of the package, put it in here, and add saline to this to make it the neon yellow color. What this is testing for is scratches on the cornea. So you'll take it and you'll put a couple of drops in the eye, and then you'll see it kind of glow bright green. And then you'll take your regular saline, drop it in there, kind of wipe it away. That way you can look for the scratches. So then you use this blue filter to check and see if there's anything. If there is a scratch, you'll be able to see it. The stain will catch that and it'll fluoresce bright green. So for him, he looks pretty good, no scratches. And then you'll want to make sure that you flush the eye out with the saline again to make sure that you get all that out of there. That's it. Okay. Alright, so the last thing we're going to be doing is testing Sebastian's eye pressure. This is a Tonopin, so this checks for glaucoma. If the pressure is high, then it's likely that that's what that is. So you start and you put the cover on it. Make sure it stays on. It's tricky sometimes. So then we will calibrate our machine. So you turn it on.
I wish there was a pause. There you go.
Okay, and then just wait.
Good.
Good. All right. Okay. Now you're ready to read. All right. So now I'm gonna put my hand here. Kind of go for this side right here. So then I will push the button, and you just kind of bounce it a couple of times, and you'll hear it reading. It'll beep when it's done. Good. Okay. So we're at 9, which is good. We like to do this about 3 times so you get an average. And then you'll go ahead and do it on the other side, and then depending on what your number says, if it's high pressure, then we'll do further diagnosis for glaucoma. If not, then it's good. Alright, so we're demonstrating how to do an enema, so I'm going to prepare it for us really quickly. We're going to use some warm water and a little bit of Dawn dish soap, and then we will go over to Hannah over there and prepare this. So you want to make sure the water's warm, not too hot, but good enough to where it's not cold. And then we'll use a little bit of the dish soap, and then kind of mix it around a little bit. All right, so we've got our sterile red rubber catheter, our 60 ml syringe, and then some lube. So we will go ahead and take these over to the table. All right. And then for this, you will get the lube and you'll lube up the end of it and go ahead and insert it into the dog. And then you'll pull up the warm water solution. And then once this is inserted in the pet, you will go ahead and place the warm water and soap into the dog. and then you'll let them set for a little bit and see how it goes. And if everything comes out great, then you're good. If it doesn't, you can repeat it until it loosens everything up in there enough to come out. All right, so we're here with Tigger, and we're going to be administering some sub-Q fluids for him. He's been coming to us for a little over a year now, and we've been giving him sub-Q fluids twice a week. He is in kidney failure, so this is good. It helps support his system and all that, and makes sure that he stays hydrated. And he's a cat that does better with less restraint, so we found that if we just kind of sit here and let him be while we go ahead and give the fluids, he does great. So I'm going to go ahead and start, and you pick up the skin, kind of make a little tent. In between the shoulder blades is where he doesn't mind it as much, and then we go ahead and insert the needle, and then open up the line. And then for him, he likes it better if we don't squeeze the bag or anything. So we just let it drip. We usually give him between 150 and 175 mils of lactated ringers. So we'll just sit here and wait a little bit for this to fill up. Okay, so we're through giving our sub-Q fluids to Tigger. He's got a pouch of lactated ringers underneath his skin, so that'll slowly absorb throughout the rest of the day or next couple of days. And so now we're gonna take the needle out, and you'll want to pinch the skin and then remove the needle and keep it closed for a little bit. That way it doesn't leak out, and then he will be good to go home. And then we'll see him again in a couple more days for some more fluids. Okay, so we're going to be doing a modified Robert Jones bandage, excuse me. I've already put the tape on here, and then there's a tongue depressor so I can make sure I can hold the foot. We're going to start with the cast padding, go from the toes up, and make sure that we use plenty of padding. The modified Robert Jones doesn't use quite as much as the regular Robert Jones bandage, but you want to make sure that you have enough to stabilize the leg. So we'll go up and then back down with the cast padding. If you need more, you can always use more. Start with a little bit more. And then after I'm through with this layer, I'll go ahead and use the sugar here. What's it called? The cling. And again, you'll start from the bottom going up. And then I dropped it.
My goodness.
Okay. And then once we're through with this, we can go ahead and use our vet wrap. You want to make sure you don't get it too tight, but good enough to where it'll stay on. once all of your padding is on, then you can take the tape and twist it and kind of go back up. And usually I'll go back around this with a little bit more of the vet wrap, and then you can use some tape to kind of stabilize, that way it's not slippery for the dog when they're walking, but got a little bit of the toe hanging out, that way they've got some more traction, and then that's that. Okay, so now that we have the bandage on, I'm going to demonstrate how to remove the bandage. So I've got my bandage scissors right here. We'll start at the top and go layer by layer, and you'll just kind of cut. You want to make sure that you are cutting on the opposite side of where the wound is. So if it's back here, I'll cut from the front. Layer one's off, so then I'll start by cutting the next layer. And there you have it. Okay, so we're demonstrating now how to splint the leg. We're using this rod splint that we have, and so we're going to start by doing the Robert Jones. So for these, we use a little bit more padding, and then you apply the wire splint afterward. So we'll go ahead and start with this bottom up. We're going to use this one for a metacarpal fracture, and we will just start by using our cast padding. Okay, so now that we've applied a very thick layer of our cast padding, I'm going to go ahead and apply the splint. So I will put this right here, and then go ahead and start with our cling to properly hold it into place. And then from there, I'll go ahead and take my tape.
There's a kitty.
And then we will use our vet wrap to hold all of this in place. You can use a couple of layers of this to make sure everything's in place, and then you can also put some tape on the bottom of this for traction for when they're walking. And that's it. Okay, so now we're going to remove the splint. Again, starting from the top, going down layer by layer. And we'll start by cutting the vet wrap off. demonstrate how to apply a pressure bandage. We would use this if we had an abdominal incision that needed to be resutured, was oozing or something like that, and we needed it to just be bandaged for a little while. So I'm going to start by using some gauze sponges and just apply them over the incision. And then I will take my cling wrap, the cast padding, and go around first. Again, you don't want to make sure, you want to make sure that you're not doing it too tight, but just tight enough to where it's not putting enough pressure on it to try and stop the bleeding and whatever's going on until you can permanently fix it. And then go around with some of the cling. And then we'll use vet wrap, and a lot of times we'll put a piece of thicker tape up top just to make sure that it stays in place and doesn't slide down. And then it's your third. I'll put the piece of tape right here, and then it should stay on for as long as you need it to. Okay, so I'm going to demonstrate basic triage on a patient. So we will pretend like Hannah was brought in as an emergency. So we'll first start by bringing her back here to the tub sink, kind of assessing the situation and how serious it is. So starting out, we will listen to heart rate, check mucous membranes, check her pulses and things like that. And for this, we're going to say she has a laceration on her neck, and then I will pressure bandage that temporarily until we can fully assess the situation. So I'm going to go ahead and listen to her heart rate. Also listening to her lungs. And then that all sounds good, so then I'll come over here, check her mucous membranes, and see how her capillary refill time is. She seems to look pretty stable, so I'm checking her pulses back here. Both pulses are strong. So then, since she's not in any real immediate danger, we will go ahead and apply a pressure bandage to her neck so that we can somewhat stop the bleeding before we have a chance to actually address the situation and do a little bit of further diagnostics. And that is that. Okay, so we are doing a dental today on this kitty. We've already got her gas down and ready to go. So I will start. I've got my hand units, piezo unit right here, along with water, a burr, and a polishing head. So I'll start by using the piezo, and I will push the pedal and the water will come out. And we will begin getting the tartar off. You want to make sure when you do it that you don't have the handpiece straight up and down, because that'll put grooves in the tooth. So you do it from the side, and that way you don't damage the tooth and the enamel. And then you do this on all the teeth, get all the good tartar off, and then after that we'll go through with our hand tools and probe up around the gums and make sure that there are no pockets or whorls or anything that we need to be addressing while they're under, along with kind of scraping a little bit more up under the gum line to make sure we've got everything good and clean. And then after that, we'll polish and then fluoride. That way we will get everything good and clean. I've got the cleaning done on the teeth. I'm opening up our dental kit to get my hand tools out. And I will use these first. And I'm gonna go along the gum line and probe around and make sure that there's no pockets or resorptive lesions or anything that's hiding up underneath there. You wanna make sure that you check every tooth and all the way around. So far, so good on this cat. He does have some gum loss, but other than that, he doesn't have anything that's pocketing or having a resorptive lesion. And you do it on both sides, and then you also do it on the inside of the other teeth that are in here that I've already cleaned. And again, nothing so far. So after I finish polishing, I'm going to take the water sprayer and spray out the mouth and get all that grit out of there. Make sure clean the tongue off and all the surfaces. Okay, so once everything is cleaned, we take our fluoride, shake it, you take a little bit of it, and then you will then rub it on the teeth. Let it sit for a couple minutes so that it does what it needs to do, and then you can wipe the mouth out, and then you'll be through with your dental. Okay, so I'm going to talk a little bit about client education for dentals. Of course, always having a regular routine dental cleaning is the best way to keep the tartar off and, you know, other things that they can get, you know, gingivitis and, you know, things like that. Cats get phorals, they get stomatitis, things like that. Routine maintenance for dentals, or for your teeth, brushing teeth is always the best option. That will entail using enzymatic toothpaste. You can get them at pet stores. We sell them here at the clinic. That's important because the dogs and cats can't spit the toothpaste out like humans can, so using the enzymatic toothpaste is more beneficial for them. You can use, they've got toothbrushes you can buy, the finger toothbrushes. Sometimes using a gauze sponge is enough to just kind of keep the bacteria load down in the mouth so that the tartar doesn't continue to accumulate. We like to explain to owners that after the routine dental cleaning is a good time to start the teeth brushing. That way the tartar doesn't accumulate quite as quickly as it would if you weren't brushing. Some other things that we like to recommend to our clients are things like CET chews. We sell a lot of those here at our clinic. There's different sizes. There's some for small dogs, some for medium breed, large dogs, things like that. They're really nice chews. A lot of them they kind of look like rawhides, but they are treated with chlorhexidine, which kills bacteria in the mouth. So the reason that those are so good is they'll chew on those and it'll kind of abrade, you know, the tartar that's on the teeth, or kind of knock down those bacteria loads. We also carry some things like water additives. A lot of dogs won't let you brush their teeth, so these are good next level options for you. So a lot of times they won't even notice them in the water. You just add, you know, however much it says on there to the water, and they drink the water, and again helps keep that tartar level from accumulating so quickly. We also have, there's some products out there that are chlorhexidine rinses. So it's got kind of a squirt nozzle on the end of it, and you can just kind of squirt it into the side of the cheek, and it'll kind of move around the mouth and in the teeth and things like that, and again keep that bacteria level down. Also, of course, you know, crunchy foods, things like that, chew bones can help knock the tartar accumulation down and keep things from getting too bad. The softer foods and things sometimes won't help that. You can kind of, it keeps the tartar building instead of having something that'll actually physically kind of knock it off if it's on there. We like to tell all of our clients about these options, and again, you know, it's hard to brush a dog's teeth every day. You know, you brush your own, but a lot of people don't think about it, so we do like to inform our clients if they're spending the money to get the teeth cleaned under anesthesia and all that, it's a good idea to do some sort of maintenance so that they don't have to, for one, be under anesthesia any more than they have to be, and two, you know, cost-wise and things too come into play. So that's usually what I like to tell them. There's some other options out there, and we send home, after we do routine dental cleaning on pets, a good information sheet that the clients can go home and read, as well as me kind of going over that with them.